So today's webinar is meant to be interactive. Thank you for joining it. So if you have a question, you can ask a question through the question and answer panel or through the chat, or if you'd like to ask a question out loud, you can certainly raise your hand and ask that question out loud. And we are going to be making a recording of this webinar, and we'll have the recording and the Stata code that I used today and the slides available from the Gateway to Global Aging data on our documentation page sometime later this week. So I encourage you to ask questions, and let's go ahead and get started. I'm going to be showing some examples as we go through today. We'll be focusing on using Stata. You can do kind of similar analysis with SAS or SPSS or R also, but for today, I'll just be using Stata. So first, I'm going to kind of introduce what are the middle income countries that have a health and retirement study as part of them. We're going to introduce a research question, which is going to kind of guide our analysis. And we're going to create a combined data set, because it's going to be a cross-study analysis. And then we're going to do some cross-country analysis from that combined data set. So an introduction to the middle-income countries with a health and retirement study. So using the World Bank definition of middle-income countries, there are two tiers of middle-income countries. There's lower middle and upper middle. The lower middle, all income categorizations through the World Bank are defined using GNI per capita. And so lower middle is defined as ranging from $1,046 US dollars to $4,095 US dollars. And the countries which have, and these are the current definitions for this for 2021. I'm going to be going over all the countries which have an HRS type study in them. We're not going to focus on all of them though for the analysis. So Ghana was part of the study, the WHO study on global aging and adult health called SAGE. They have done, I believe, 3 waves of SAGE, but that all have included Ghana, but only the first wave of data is currently available. And that was conducted in 2007 and 2008. In Indonesia, there's also a study called the Indonesian Family Life Survey, or IFLS. It is actually an older study, but starting at wave 4, they adjusted IFLS to be more similar to the question wording in the HRS family of studies. So it's considered comparable starting at wave 4, and they've done wave 4 and wave 5, and those cover the years 2007 to 2015. Also in India, we've recently finished up the wave 1 of the Longitudinal Aging Study in India. It's also called LASI. That data is currently available now, and we will be going into the field for a second wave there in the coming year. So upper middle income countries, there's a little more coverage. Those include, those range from the US dollar figure of $4,096 to $12,695 GNI per capita. So Brazil has a study. That study is called LASI, and it's the Brazilian Longitudinal Study on Aging. They have 1 wave of data available that was collected in 2015 and 2016. China has a study called the China Health and Retirement Longitudinal Study, or CHARLS. They have 4 waves of data available, and they range from 2011 to 2018. Costa Rica has a study called the Costa Rican Longitudinal and Healthy Aging Study, or CHARLS. They have collected 5 waves of data, and actually this is a study which is no longer continuing. So there are no plans, and there's no current data collection as part of CHARLS, but they have 5 waves of data that they collected, and those are available from 2004 to 2014. Malaysia has a study called the Malaysia Aging and Retirement Study, or MARS. They have 1 wave of data available that was collected in 2018 through 2019. I believe that they are currently in the field collecting their second wave now. Mexico has actually the second oldest study in the HRS family of studies, and that's called the Mexican Health and Aging Study, or MHAS. They have 5 waves of data available, ranging from 2001 to 2018. Russia also was included as part of WHO's study on global aging and adult health, or SAGE. And there, again, they have that 1 wave data that's also available currently as part of the SAGE data, which was in Russia, was collected between 2007 and 2010. And then South Africa also has kind of an HRS style study that's called Health and Aging in Africa, a longitudinal study of an in-depth community in South Africa, or the acronym is HALSI. They have 2 waves of data available, ranging from 2014 to 2019. The one preface I will say about HALSI is that HALSI is not a population representative sample. So it focuses on 1 community, and it is a longitudinal study with HRS type style questions, but it is in 1 community, as you can see from the name, that's in the country of South Africa. It is not representative of the entire aging population of South Africa. So that's kind of just a broad overview of what are the middle income countries which are covered. Not all of those has the Gateway developed harmonized data sets for. So there are harmonized data sets for 5 of those countries. So those include the harmonized MHAS for Mexico, the harmonized CHARLS for Costa Rica, the harmonized CHARLS for China, the harmonized LASI for India, and the harmonized MARS for Malaysia. And these are all generally up to date, except with the exception of the harmonized MARS, which has not yet, if you see here, it incorporates the first 4 waves of MHAS, harmonized MHAS. It incorporates the first 4 waves of MHAS, even though there's 5 waves currently available. So they had a wave in 2018, which hasn't yet been incorporated, but it will be starting next year. We're working on the incorporation with the MHAS team. So let's introduce our research question, or our kind of broad framing. So we're going to be looking at caregiving burden, or possibly looking at unmet care needs. And we're going to be looking across 3 different countries. So we're going to focus on Mexico, China, and India. So we're going to be utilizing the harmonized MHAS, the harmonized CHARLS, and the harmonized LASI data. So the next step is we're going to create a combined data set. We want to take those 3 data sets and we're going to put them together. So the steps for that are going to be to download the harmonized MHAS, download the harmonized CHARLS, download the harmonized LASI. We're going to identify the relevant variables we want out of each of those. We're going to create a combined analysis data set, and then we're going to create some additional variables that'll help us in this cross-study analysis we'll do in the 4th step. So to download the harmonized MHAS, you can download the data file, the codebook, and the creation code from the MHAS website, and that's mhasweb.org. And that's under the constructed or harmonized tab of the data page. They distribute their file in SPSS, Stata, and SAS format. And I'm going to just go ahead and we're going to switch over quickly to the Gateway. We'll start here at the beginning. And if you're looking for links to any of these, you would click on the Downloads tab. And then you can see here on the Downloads tab, we have a Downloads page. You can see we have a couple of tabs, one for Core Interview, End of Life, Life History, or Harmonized Cognitive Assessment Protocol. For all the ones that we're working on today, we're just going to be looking at the Core Interview data. You can see with MHAS, we can go down and we have download harmonized data set here with MHAS. You can also download the harmonized codebook or create the harmonized data with the harmonized Stata code. In general, and especially for these studies that we're looking at, the harmonized Stata code is just for transparency reasons. And if you wanted to change kind of the way certain variables were created, you could see exactly the code that we used. But to find this link, you could click on harmonized MHAS. The Gateway website does not, when you click on that link, it doesn't download the harmonized MHAS for you directly. But what it does do is it takes you to the Harmonized MHAS website. And from the MHAS website, on this data tab, you can click on constructed and harmonized. And then you could say, I'm interested in Stata, Stata data sets. And then you can say under here, harmonized, you can say, I want the data file for the harmonized MHAS data. It will require, if I go here and so click download, it is going to require you to log in. So there are 2 registrations that you have to do to download each particular data set. So you have to be registered on the gateway generally, and you have to be registered with that study. This is a very quick registration, and actually it's instant in the case of MHAS and CHARLS and actually LASI, you don't need to, you only have to be registered on the gateway, but so you can get very quick access to these data sets. So just by logging in, I could log in with my username here from the MHAS website. And once I do that, I downloaded the data file in whichever format I would like. For the purposes of this, I'm going to be downloading the Stata data file. We have a question from Preti, which says, are these harmonized data sets across 3 countries cross-sectional or longitudinal? So all of the harmonized data sets themselves are kind of what we call fat files, meaning that they're longitudinal. So for instance, if there's 4 waves of MHAS data, as you can see, running from 2001 to 2015, all of those are in the same data file called the harmonized MHAS. So they're fat or kind of longitudinal files. The next step is to download the harmonized CHARLS. This is a data set that's only distributed in Stata format. And if we jump back to the gateway website, actually, I think that currently the CHARLS website, as of this morning, wasn't working for me. Sometimes the CHARLS website does go down, and you could send them an email to get it back up and running. It looks like it currently is still down. It's been up for quite a while, but that's how you would download it if you haven't downloaded it already. And then you can see here in this image that you would click on harmonized CHARLS, and then click Stata or data files and harmonized data set, and it's distributed just in Stata formats. For the okay, so for the harmonized LASI, the harmonized LASI data file in CodeBook can be downloaded from the gateway itself. As I mentioned, you don't need to register twice. So if you're already a registered user of the gateway, you can download the harmonized LASI. And the data file is distributed in Stata, SPSS, SAS, and R format. You can do this from the downloads page of the gateway. So I'll jump back here to the gateway. And here we are on our downloads page. And so what you want to do is just follow the LASI column, and you can click on download harmonized LASI. It'll take you to a larger page, which has information about how to get access to the full wave 1 LASI data. And actually you have to you have to fill out a data use agreement, you can see here, to get access to that full LASI wave 1 data. But if you also scroll down a little bit, you can download the harmonized LASI data without, it does not require, since it's a more refined set of variables, it doesn't require this data access use agreement. So you can download it in Stata, SAS, SPSS, or R. So the next step we want to do is identify our relevant relevant variables from these data sets that we're going to use. I'm going to do kind of our research question here. I'm just going to do a cross sectional analysis. We're not going to be doing a longitudinal analysis for this. So I'm going to pick 1 year. And if you are interested about thinking about how to pick the year, I can certainly tell you generally what I do, which is if you go to Surveys at a Glance on the Gateway website and you click on Core Interview, you can see here this table that kind of gives you an idea of the timing of each wave of each survey across time. So what we're going to actually do is we're going to pick 1 year, and it's not really going to be 1 year, but we're going to say it is. So I think the ideal year to pick would be probably 2018, because 2018, actually this LASI, although it's here in this row, LASI was conducted between 2017 and 2019. So it does span these two rows. So I could use wave 1 of LASI, and I can use wave 4 of CHARLS. And ideally, I would be able to use wave 5 of MHAS. As I mentioned, wave 5 of MHAS is not yet incorporated into the harmonized MHAS, although it is available, or the MHAS wave 5 data is available. It's not part of the harmonized MHAS wave 4 yet. And this is something that will happen, as you're doing kind of cross-study analysis with these data sets. There will be instances when once a study makes data available, it takes our team a few months at least to go through and update the next wave of harmonized data, because it's quite an intensive process. So there could be times when you don't exactly get the wave correlation right, but let's say we're going to just use wave 4 of data. So we'll kind of proxy this 2014 data for 2018. So once I have that, we're going to also use as we picked our year of interest, 2018, with the caveat, we're really going to use 2014 for MHAS. And the next thing we're going to do is we want to talk about a measure of disability. So some of the common questions that are asked about kind of disability or limitations with function and functionality include difficulties with activities of daily living, which are also called ADLs, and instrumental activities of daily living, or IADLs. If you wanted to get an idea of what are the kind of measures that are collected across these different studies, what I would suggest doing is on the Gateway website is actually going to this concordance cross surveys tab. You can see here that we've got lots of options, and one of them under health is functional limitations. And what you can see with functional limitations is there's a number of different ones that are referred to as ADLs, and there's a number of different ones that are referred to as IADLs. You can also see that not all of them are asked by all studies. For instance, these first ADLs of bathing, eating, getting in and out of bed, using a toilet, these are all asked basically in all the studies which are indexed on this table here. Difficulty walking across a room, though, was not asked as part of CLOSA. And difficulty dressing was not asked as part of CHARLS, that Costa Rican survey data. So we're not going to actually use either of those. But so it might give you an idea if we're going to focus on MHAS and CHARLS and LASI, what are the comparable ADLs that we could use? Similarly, for IADLs or instrumental activities of daily living, these include things like managing money, difficulty taking medication, difficulty shopping for groceries, difficulty preparing hot meals, and then some other ones. We could also identify which are the ones that are asked across MHAS and across CHARLS and across LASI. And we have these concordance tables for a number of things. You could also, for instance, look at some health behavior variables like smoking or drinking or physical exercise. If you look under just the health table, you can see people self-report their health. They have self-reported vision, hearing, dental, a lot of different doctor-diagnosed conditions, including hypertension, diabetes, heart problems, stroke, asthma, emotional, nervous, or psychiatric problems, memory-related diseases, high cholesterol, whether people have had a fall, pain, and then also people's self-reported body measurements. And this is just in health. We're just looking here at kind of a health outcome. But you can look from any of these concordance tables and find lots of kind of the comparability across studies for these different, for this HRS family of studies to kind of find what are the items that are best suited to you. I think kind of the next step for me is we're going to pick some additional variables also. So we have this additional measures. We're going to bring in a measure of whether you receive help with ADLs or IADLs. Caregiving is, of course, like a really important consideration when thinking about disability or difficulty getting around and the aging process in general. So we'll bring in a variable that records whether they're getting help. And we could utilize this variable, for instance, to identify unmet need. Say someone is having trouble making meals and they're not receiving help with that from anybody. That could be, that's a really important indicator of unmet need. We'll also bring in just some basic demographic variables, which are often helpful to explain disability. So we could bring in birth year or age, depending on how you wanted to look at those differently, gender, education, and urbanicity. And then you can see that we've got here for each of our, kind of in smaller font, for each of our data sets, I've got the variables listed out, those variable names. You can see here for count of ADLs for MHAS, this is called R4 ADL5. The harmonized variables all have a similar variable naming convention. So the usually the first two letters are usually R, S, H, or HH, representing whether it's about the respondent, the spouse, the household as a couple, or the kind of full household, meaning anyone else who lives with them. The next letter or number can either be a number or the letter A, and that represents the wave that it's specific to. Or if you look down here, a variable like birth year, you can see it's RAB year, and that means it's kind of, we think it's kind of a lifetime variable. It's not something going to change. Your birth year is something that's at when you're born, and it's not going to change wave to wave. So you don't need a birth year at wave 1, a birth year at wave 2. So we call that an RA or all B year variable. And you can see we have this ADL5. Now I say this is a count of ADL difficulties. And I say that we have this as part of the harmonized MHAS, harmonized CHARLS, and harmonized LASI. Of course, we're going to be using wave 4 of MHAS, so that's called R4 ADL5. We're also using wave 4 of CHARLS, so it has the exact same name of R4 ADL5. And we're going to be using wave 1 of LASI. Even though these all, for CHARLS and LASI, they both refer to 2018, it's wave 1 of LASI and wave 4 of CHARLS. And then, so harmonized LASI, it's called R1 ADL5. We have a question here, which is, the concordance tell us which variables are present, but do they link to specific variable names? So no, the concordance tables tell you about what questions are asked in the survey, but they don't link to the variables. So that's kind of the next step, is like, once you identify the questions that are asked, you want to be able to find those harmonized variables. And I'm going to show you a couple different ways, or 2 different ways to do that we're going to focus on. So the first is we've built into the search functions here at the surveys at a glance tab on the gateway, this thing called subtopic. And what subtopic does is it searches just harmonized variables. So for instance, if we go down, let's say we were looking at, if we jump down to health, we can see ADLs. And let's say we want to look at ADLs, and we want to look across harmonized LASI, harmonized MHAS, and harmonized CHARLS. And we can just leave the years as it is for now, and we can search. If we look at 2016, this is where LASI wave 1 is coming up here. We can see that we have, these are the actual variable names related to ADLs. And if we scroll down quite a bit more, we'll get to some of these summary variables. So you can see we have a variable called R1ADLA, and that's a 5-item summary variable. We also have one called ADL5, and that's the one that I referenced actually on our slides. And that's another 5-item one, but it's a different 5 items. And the reason to have 2 different 5 items is because, as you saw in that concordance table, not all studies are going to ask the comparable set of ADLs. And so depending on what study you're comparing it with, it might be helpful to have these different aggregate variables already made for you. So we can refer to this one. We could also look for something like, let's look for gender and we search here. And what we can see is that for the harmonized MHAS, this is going to be named RA gender. So this is the variable name, and we know that it's coded 1 means man and 2 means woman. We could see that same variable for CHARLS, that is also RA gender, with a code of 1 for man, 2 for woman, or for harmonized LASI with a code of 1 for man and 2 for women. So one of the nice things about using the harmonized variables, although this is a very simple example, is that they're always going to have the same value codes across all the different data sets. So we know that this variable is made comparably. It has RA gender as part of all of them. So this is one way to look for these. The other way to look for them would be to use the use the code books. So each data set is accompanied by a code book. I'll bring these code books over here. So this is the harmonized LASI, or the harmonized MHAS code book. And all the code books have bookmarks. And you can also go through this code book to find the variable name. So similarly, if we go through, let's jump back to ADLs. And you can see we have raw recodes. So this is the individual ADLs. And then we also have a section on ADL summaries. So we have quite a number of summary ADLs that are built for MHAS, including one called ADL TOT, or total underscore M. If you see this underscore M, and we're not going to encounter it today, it can be underscore M or underscore some other set of letters. The harmonized variables only use underscores to indicate that something is country specific, in this case, or study specific. In this case, we're saying that this variable is MHAS specific. So we wanted to give a total summary indicator for all the ADLs that are asked in MHAS, but that this list of MHAS ADLs is specific to MHAS. So we create that variable because if you're just looking at MHAS, let's say you just want to do an analysis inside of MHAS across waves, a longitudinal analysis inside of one study. This variable might be really helpful, right? This is going to be the most fine-tuned ADL measure, summary ADL measure you can have inside of MHAS. But we also have some other ones, including that ADLA that we saw before. And we have ADL5, that's the one we're actually going to use. We're going to use this wave 4 version here. And we also have a 4-item ADL. So that's called ADLA underscore M. And then actually we have a third one. So we have 4 different summary indicators for ADLs inside of the harmonized MHAS. And this is a 3-item. So depending on what study you're comparing to, these can be quite helpful depending on how many ADLs were asked in that study. And if you look a little further down, we have some basic demographic statistics, but there's a lot of text. And you can see here exactly for these 5 different summary ADL measures, what's included in each of them. And you can also see some text about perhaps like why they were made. For instance, we say here the 5th summary measure uses the ADLs proposed by Wallace and Herzog in this 1995 paper that a lot of people base research off of. So if you're trying to stay kind of inside of that research vein, you could use this summary measure, this 5th one here. This is a 3-item. For our purposes, as I mentioned, we're going to be using this 5-item because we know that bathing, dressing, eating, getting in and out of bed, and using the toilet were something that were asked by all of these 3 studies that we're going to use. The other thing that you can see here, and it's probably not interesting, or it is a little interesting here, is that we have 2 more sections. One is cross-wave differences. So if these ADL questions changed between waves of MHAS, that would be important to know. And then we have a section called differences with RAND HRS or harmonized HRS. And so here we record the way that this study might be different from another study. We always use HRS kind of as our basis for comparison, just to have one study that we can speak against, even though we aren't using HRS here. If we're able to look through and read this section for each of them, in which we could, here's also the LASI codebook and the CHARLS codebook. I've got these all pulled up since we're doing this analysis today. I could look at this differences with the RAND HRS section for each of these. And you can see here that there is a little bit of difference. In the HRS, respondents are asked if the activity is a little difficult, somewhat difficult, or very difficult, and then they're recoded to any difficulty. And in MHAS, they're only asked if they have some difficulty. So it sounds like there was, the HRS uses a little bit of a finer tuned question, but in the RAND HRS variables that contain this variable, actually they've kind of recoded them anyway. And so our coding, it sounds like probably we could also, if we wanted to, we could incorporate the HRS here into this analysis also. So those are kind of two different ways to both through using the Gateway website or from using the Harmonized codebooks to get a sense of what are the variable names that match to that survey question that I'm interested in, the Harmonized variable names. So you can see here for each of the data sets that we're going to use, MHAS, CHARLS, and LASI, I've listed out what are the variables that we're going to use. So we're going to use the R4 ADL5, or I'm just going to say the ADL5 variable, the IADL4 variable. That's going to be a 4-item count of ADLs. We're going to have a binary indicator of whether receives help with either ADLs or ADLs. That's called RCANY. That's received any care. That's kind of how we thought of that variable name. We'll have a birth year variable called B year, an age variable called AGEY, a gender variable that we already saw called gender. We also have a kind of internationally comparable harmonized education variable called EDUCL. And this is really designed, it's using ISO codes to compare education across countries. So to really get a sense of what is mainly primary, secondary, or tertiary education across these different countries. I think the urban-rural divide is important both in middle income and high income countries. So we're going to include an indicator of urbanicity, which might be important. And then the last thing we're going to include is our analysis weights. There's lots of reasons to include weights for the data. So one can be that there's a slightly biased sample size. It could be that not everyone responds at the same rate. So you really want to make sure you're using analysis weights. A really common example of this is, although all these studies look at people of 45 and older, it's really common for men who are working age to not be home when the interviewer comes to the household. And so they won't be able to fill out a survey. So often men between ages of 45 and 60 or 65 aren't sampled as frequently. And so what the weight can do is for those men who are sampled as part of that, it can give them slightly more weight to make their answers proportional to the people that they represent in the population. You'll also notice maybe a few differences here. All the variable names aren't exactly the same apart from whether it's the wave number. You can see that the rural variable in LASI starts with HH, and that's because the LASI survey interviewed multiple people in the household, like even multiple couples in the household. So you want to distinguish kind of an HH or full household level from an H level or couple level, whereas the MHAS only interviewed a respondent and their spouse if their spouse was there. So we just call that an H level. They're going to mean and work exactly the same, but that's why that variable naming difference occurs. Also, in the CHARLS, our weight variable, it's WTRESPB. CHARLS has kind of 3 levels of weights that they provide based on what you want to control for. This WTRESPB is the one that's most comparable because it deals with the household and individual non-response rates. It's most comparable with the weight that we have for MHAS and for LASI. So at this point, we're going to switch and I'm going to start showing you some Stata. I'm also going to run these commands also in Stata. So let me open up my Stata window. And I've got a do file that we're going to run here. And while we run through this, we're going to look through kind of our results in the Stata window, and then we can also kind of talk about them a little bit. So the first thing we're going to do is we want to load these piece by piece. So we're going to start in the kind of the same order we've been talking about them, which is we're going to load the harmonized MHAS first, and then CHARLS, and then the harmonized LASI. So to load the harmonized MHAS, we're going to first use the Stata command of use, and we're going to include 2 extra variables in addition to that list of which I already mentioned. And those are an indicator for, those are the indicator for the unique person ID inside of that study, and an indicator for whether they were part of the wave that we're interested in. So whenever you bring in variables or make combined data sets or other data sets, I would say always as a rule, keep your merging IDs or your indicator of the observation number, so that you could always, so you don't lose who those people are. You know, if we got to a certain step in this analysis and we said, you know, I think number of children would be really important to consider here when we think about caregiving or access to caregiving and informal caregiving through children. You know, I want to look at people who, you know, have fewer children to be able to take care of them. Instead of starting over, actually, we could take our existing data set, and if we've kept in these unique identifiers per data set, we can just merge that other data in later. So we're going to keep those unique identifiers. We're going to list all the 4 variables that were all the variables that we listed before that we're going to use. So we're going to do that, and it's using, this is MHAS version B3. That's the currently available MHAS B3. When we come out with the newer version of MHAS, which includes wave 5, that will be called HMHAS version C. And the next thing we're going to do is, because we're doing a cross-sectional analysis and we're going to be using only one wave of MHAS, we can just go ahead and drop anyone who wasn't part of wave 4. So we're going to say drop if INW4 is equal to 0. So we're only going to have people who for INW4 is equal to 1, meaning they were part of that data set. The next thing we're going to do is we're going to bring in the CHARLS data, and we're going to do that using an append command. So what append does, you might be more familiar with a merge command. And what merge does is merge assumes that the observations that are already in the data set should be matched to this new set of data through the merge, right? And you say merge using merge ID or unique identifier or something like that. But what append does is append actually doesn't assume that the data are the same across the data sets. It actually assumes the observations are all going to be different. And it's going to put that data set below the other data set. So we can say append using the harmonized CHARLS version D data. That's the latest version of the harmonized CHARLS. And then we're going to use this option of keep. And here we're going to list the variables we want to pull out of the harmonized CHARLS. And actually, you can see in both of these, both our first step with the harmonized MHAS and our second step with harmonized CHARLS, that we don't just load the whole data set. You certainly could, depending on your version of Stata, load the whole data set. If you have a version of Stata, Stata has a couple different, I think what they refer to as flavors. And some of them have a limit on the number of variables that you could load in from a data set. And although it's probably, you would be fine with the MHAS and the CHARLS and the LASI data, when you talk about a data set like, for instance, the HRS, which has 14 waves of variables. So for every, and it's also a large sample, right? So for every observation, there's a variable for all 14 waves. So they have 14 rural observations because that's something they can change per wave. It's a ton of variables. And depending on your version of Stata, it might not be able to load. Also, depending on the amount of memory or RAM you have on your computer. For my practices, I generally just like to keep it refined to just those variables I think I'm going to use. And I can do this in the append command by specifying which variables I'm going to keep here. So we're going to keep our ID variable. So that's the unique identifier inside of CHARLS, INW4, and then these variables that we already listed. And we're also going to use the second option of generate append. And that's because we want a variable which is going to tell us which study these data came out of. And the first thing we're going to do is we're going to drop if INW4 is equal to 0. So just like we did above, we're going to say drop any observations who weren't part of wave 4. And then we can recode our append variable. Append is coded as 0 or 1. 1 being means it was part of the appending data set. So we're going to call everyone from the MHAS data, we're going to give a value of 1, and everyone from the CHARLS data will give a value for 2. If I look over here at Stata, I've stopped kind of at the end of this here, and we could do tab country. And what you can see is we've got our values there of 1 and 2. We've got 14,000 something people from the MHAS data and almost 20,000 people from the CHARLS data. So those data are in there. Also, if we wanted to use our variable viewer as part of Stata, we could see, we could look at any of these. We could also, let's look at our INW variable, and let's just make sure what should be true is that we only have values of 1, right? Yes, everyone who's currently in our data set was part of wave 4 of either MHAS or CHARLS. So that's perfect. That's exactly what we should, that's what we're expecting to have happened. In our next step, we're going to bring in the LASI data. So we're going to append harmonized LASI here, just like we put the CHARLS data on top of the MHAS data. We're then going to put the LASI data on top of those two, or below those two. So we're going to append using HLASI_A2, or the version A2 of the harmonized LASI. That's the current version of harmonized LASI that's available on the gateway. We're going to use this same keep option. We're going to keep the unique identifier for LASI, which is prime key. Remember, for LASI, we're using wave 1. So we're going to keep that indicator for whether in wave 1. We'll just keep it for now. And then we're also going to generate another append variable. We can then say replace country is equal to 3 if this append is equal to 1. So now we've got country with the values of 1, 2, and 3. And we can kind of define that better. We can say label define country. 1 is equal to Mexico, 2 is equal to China, and 3 is equal to India. And so let's jump over in Stata and let's just walk through that step. So yeah, and if we tab that variable, we see our same counts for Mexico and China, but now you can see that we've added 72,000 people for the LASI study. LASI is a massive study. So a lot of people were included as part of LASI wave 1. So we've got all those people in there. So that's a great start. I think one thing you'll also just to note is that we didn't use a drop statement here with LASI. And we didn't use that drop statement because since we only have one wave of LASI available, there's no one who wasn't part of that one wave. So we don't need to do that. If let's say this is 5 years down the road and we have 2 waves of LASI data now available, you would want to include that statement here because there's going to be some people who were part of wave 2 of LASI who weren't part of wave 1. And actually, you don't have to drop this. This dropping people who aren't part of our waves of interest and this kind of only keeping the variables they're interested in is kind of like my way of just kind of keeping my analysis quite refined. But those are both optional steps. And if we look at the variables we have available, you can see we have a number of variables that are available. one of the things you'll also see is that some of these variable names are different, and that's what we saw before. For instance, although we have an age at interview for each of the studies, in LASI, that's called R1 AGEY, and in CHARLS and MHAS, that's called R4 AGEY. So for our kind of combined analysis, the next step we're going to want to do is we're going to want to create some additional variables, which instead of being wave specific are country specific. And there's also a question, which is, can we have the slides and recording later? So yes, I mentioned this at the beginning, but I'm happy to mention this again. So we're making a recording of this video, and we'll be putting the recording of the video, these slides that I'm going over today, and the Stata creation code in like a Stata file available on the Gateway to Global Aging Data on our documentation page there. And I'll show you where that is at the end of this. That should be available later this week. So if you're thinking everything's moving a little too fast here, or I want to look at this or adjust it on my own, you'll have access to all these files towards the end. So in our next step, what we're going to do is we're going to make these year-specific variables. So we can have a variable like R 2018, ADL5, and then we can assign our values from each of our studies. And this is why having this country variable is really important, right? We want to remember for each of these observations, where is the values for that data? Where is it stored? Because inside of Stata, it's just one big data set now. We've gone through the step of combining it all together. We could actually kind of look at this in the Stata viewer. And you can see we've got all these respondents, and for a lot of these, there's nothing, right? So these first respondents are from Mexico, and of course they have nothing for these R1 variables because we didn't bring any wave 1 variables from MHAS. So we want to keep in mind where they're coming from. So for that, we're going to say, if our country was Mexico, meaning you came from the MHAS data, we know that your ADL5 values would be stored in this variable called R4 ADL5. That'll look exactly the same for the CHARLS data or country 2. And for the Indian data or country 3, we know that your values are going to be stored in the variable called R1 ADL5. We can do the same thing for ADL5 and IADL4. So if we do that inside of Stata, now we can see that if we can say let's bisort country sum R 2018 ADL5. So you can see that now for this variable of R 2000 ADL5 country, ADL5 by country, we have values for Mexico, for China, and for India. Because these are comparable variables, they all are going to have the same range, right? They're all 5. Because they have exactly the same variable name, we know that they're designed comparably. So we have, they range from 0, meaning they have no difficulties with any of the 5, or 5, meaning that they have difficulties with every single one of those 5 difficulties. So we're going to do this. We're going to make these kind of year-specific variables for our ADL variables, our IADL summary variables. We're going to do exactly the same thing for our rural variable. Of course, remember here that in this last step for LASI, that variable is named HH1 rural if country is equal to 3. We'll do the same thing for our age variable. That's the age at this interview wave. We'll do the same for our indicator of whether received any help, and the same for our weight variable. So we're going to take our weight variable from each of the studies individually, and we're going to combine it into the same variable. And we're going to talk about weighting in the next step. But first thing we're going to do is we're going to make this kind of combined weight variable. Of course, here the important thing is remember that CHARLS, the comparable weight variable, is named WTRESPB. And to find out something like this, I think you might be wondering, so how do I know which of the weight variables that is? So again, I would say the easiest place to find this would be to refer to the Harmonized CHARLS codebook. And you could look at the person level analysis weights, and you can see that they have these weights. There's a discussion in the How Constructed section about exactly what each of these variables represent and which would be comparable. to what we have for the other studies. All right, so now that we're done, we've made all of our, let me jump through in Stata and finish here. So we're going to make all of our year-specific variable names. The next step that we're going to be doing is we're going to look at ADLs and IADLs together, just kind of combined. So I'm going to make a combined count of ADL and IADL difficulties, and I'm going to call this ADL IADL. And all we need to do that is we're going to say add together our ADL5 variable plus our ADL4 variable. So we're going to have 9 possible limitations, right? This should range from 0 to 9. And the next step we're going to do is we're going to create a binary indicator of any ADL or IADL difficulty. And to do that, we're going to call this variable any diff. So we're going to keep using our kind of year specific variable name. So R for the respondent 2018 any diff. And it's equal to 0 if our ADL IADL variable is equal to 0. And it can have a value of 1 if that ADL IADL variable is ranging from 1 to 9. So if they have 1 or they have 9, and our new variable, they're just going to be coded as a 1. So this is going to be a binary indicator. And we can also define define a label of no difficulty or difficulty, and then assign those labels. So let's do that inside of Stata, and we could tab that variable. So let's say tab R 2018 any diff. So you can see that most people in our kind of combined sample, 73% of these people, these observations don't have any difficulties. But there are also a lot of people who do have difficulties. More than a quarter of the people are having difficulties with at least one of them, right? And these are things that really might hinder your day-to-day activities. They might hinder your ability to go to work, to take care of yourself, to get dressed, to feed yourself, for instance. So these could be quite important. All right, so kind of in our last minutes here, we're just going to get into the slightest bit here of cross-country analysis. And to do this, I'm going to go through this quite quickly, but we're going to apply weights. We're going to do some cross-study univariate analysis of disability prevalence, and then a cross-study multivariate analysis of disability prevalence. And at this point, we haven't even talked about unmet care need. We're not going to be able to get into that. But I think thinking about who meets these care needs is so important that I wanted to be able to mention that. So the first thing for weights is we're going to use this command that's available in Stata, and there's kind of similar. You can structure this the same way in SAS, although it's going to look different, or SPSS. But what you want to tell whatever program you're using is that although we've combined this weight, it's accounting for different groups inside of that. And we can tell Stata that by specifying different strata here. So the strata here we're going to identify as countries. So it's just saying that there's going to be 3 strata: United States, or Mexico, China, and India. And those weights are going to be specific inside of that strata. That's probably as much depth that I'll go into it here, but this would be kind of the best way, given the indicators that are available for the study, to make sure that Stata is treating this combined weight appropriately. The nice thing about Stata is you can have this one command where you set SVY set, and you tell it the weighting or the stratification or the clustering. This can actually, depending on what studies give you, you can get into multi-stage stratification and clustering here with this variable. And so if we jump in Stata and do this, we can also use SVY describe. You can see that we have our 3 strata here, 1, 2, and 3, and this corresponds to the observation number that we want. So this kind of makes quite a bit of sense here. So that's perfect. And our next step, let's just look at the proportion of people who have any difficulty over each country. And in Stata, you can do this with SVY, which just reminds Stata, whatever I said in SVY set, recall that now. So we don't have to, again, say our stratification or our weighting variable or clustering variable if we had listed that. And then we're going to estimate the proportion of people for R2000 any diff. And we can do that over country. So we're gonna not kind of, it would be inappropriate to kind of look at the proportion across these three countries. But what we could do, because the weights were not intended for that, certainly, they were intended to make an observation specific to that country. So we can do that inside of Stata. And we're just going to look at the difficulty proportion. We're going to ignore these kind of first three estimates that we get. But for difficulty for Mexico, China, and India, we can see that in Mexico, the proportion would be roughly 18% of people in the MHAS sample, 26% of people in the Chinese sample, and 27% of people in the Indian sample we would estimate to have a disability. And if you want to look at that graphically, we could look at that here. So we kind of see that difference. One thing that we don't want to do at this stage, which you might be tempted to do, is that I don't think we want to compare these estimates using a post-estimation test to see if they're statistically significantly comparable. Because again, the weights that we're using weren't designed for cross-country comparison. They were designed for comparing inside of a country, or they're really provided to estimate inside of that population, not a global population. But we can still see here some significant level differences between the different countries. In our next step, we could just add in something like gender. So this is where we're going to get into looking at kind of the difference in difference, or a difference in one country versus a difference in another country. And we can do that with a really comparable looking statement inside of Stata, which is SVY proportion, R 2018 any diff. And in our over option here, we're going to say over country and gender. So what that's going to do is we have three countries and we're looking at two genders in each of those countries. So we're going to get 6 estimates for each country. If we do that inside of Stata, again, we're just going to look at our difficulty. The no difficulty will just mainly be the opposite of the difficulty. So we have difficulty for men in Mexico, women in Mexico, men in China, so and so on. We can look at this graphically. Oh, I forgot to include that graph. We could have looked at that graphically. But what we can see is that between men and women, women have higher levels of difficulty in Mexico. Women have higher levels of difficulty in China versus the men, and women have higher levels of difficulty in India versus the men. And this, to compare these estimates, for instance, inside of India for men versus women, this would be an appropriate time to do a kind of post-estimation statistical test. So we could run, for instance, an adjusted wall test of whether we think that these two estimates are statistically significantly different. We could also look at these confidence intervals, these 95% confidence intervals, and we can kind of guess that these are probably statistically significantly different. And in our final and last step is we're just going to do a multivariate analysis. So we're going to include all of our indicators, so gender, age, education, and urbanicity, into a logit model to kind of look at the likelihood of someone develops a disability. And again, we're going to use that same SVY command to compare. What we can see here is that across all 3 of these countries, and in this case, I've combined these countries. Another thing that you could do is actually you could include an indicator of country to say, controlling for all of these across these different countries, do I see a difference? It's actually, that'd be interesting to do. So let's just reuse this command, and we're also going to include country on there. So what we can see here is that gender is always associated, increased gender, and really here, what by gender we mean whether being which is whether being a woman, is statistically estimated to have quite a large effect on your likelihood of developing disability. Similarly, age is important, but this is just one age change, so it's not increasing that much. Here we have our education variables. Our constant here is less than upper secondary education, or like less than high school would be the comparable in the US. You can see that both of these are statistically significant. Being rural increases your likelihood of having a disability in this study. And also compared to Mexico, we can see that still, even comparing for these kind of population dynamics between the countries, that China and India still have much higher increased rates of disability than does Mexico. So that's kind of it for this analysis. Again, we just went into the simplest portion for the analysis, because what I really wanted to do is focus on what are those countries that are available, and how do you think about finding out what's comparable across different studies, and then kind of creating your combined data set. But there's lots of interesting considerations to think about with this analysis and so many other analyses that are possible using kind of the diverse data set that is these HRS family of studies. Really briefly, I'll just mention that if you do want the slides, they'll be available, the slides or the data code, the recording of this webinar, they'll be available on the documentation page of the website right here under recent presentations, and we should have that available later today. So I'm happy at this time to answer any additional questions that anyone would have. You can ask that in the question and answer or the chat, or if you'd like to ask your question verbally, you can raise your hand and I can unmute you. So the first question is, when do you expect the newest wave of MHAS to be harmonized? Can you clarify when the weight should not be used to test significance? So to the first question, we're planning to work with the MHAS team starting next year. The MHAS, I believe right now they're in the field. Their team is in the field for their wave 6. So they are quite busy. So I think it will wait until after that. So my guess, and then the harmonization process will take maybe 3 or 4 months, but my guess is somewhere towards the middle of next year, the harmonized MHAS would be updated with that wave 5 of MHAS. And then to your second question is, can you clarify when the weights should not be used to test significance? So I think the input, weighting and when is weighting appropriate, or the appropriate ways to weight is a hotly debated topic. I think the most basic rules, though, would be to use the weights as intended. And none of the studies intended the weights to be used kind of globally. They were intended to be used to estimate what was true of the population of that country, right? To adjust for their sample, how their sample might be different from the total population. So I would say, for me, I would use weights always. I wouldn't be testing post estimates from different countries across each other, but inside of one country. One thing we could do is we could look at the difference. One thing, a kind of difference way of finding something would be, let's say that we looked at one country and we found that there was no significant gender difference in disability. But we looked at another and we found that there was a significant difference in the estimates for gender prevalence of disability. So that's a really interesting finding. And that finding itself is kind of important and significant. The next question is there data on Nepal from Preti? Preti, I'm not aware of any data that has been collected on Nepal. Yes, I have not heard any considerations of that happening. And then Tanya asked, is there going to be any COVID-19 specific harmonized data? Yes, actually that is something that we are working on at the moment. Almost all of these studies, once COVID had started to become a global pandemic, they introduced what they called COVID-19 surveys. And they did that, of course, not by going to people's houses, given how COVID works, but they started calling people on the phone and asking them questions about their experiences during COVID. So that data is coming available. We will have harmonized versions of that data. I think those will start to be available sometime, definitely sometime in the next year. I probably couldn't give you an estimate. I would say by the end of next year, for sure, some of that will be available. But I know that the HRS, ELSA, SHARE, LASI, I think MHAS, CHARLS, almost all of these studies have conducted some kind of COVID-19, I believe, study. So that data will, of course, be super interesting once it's available. Not all of the studies have released that data yet. Of course, it takes the studies time to go through and first clean clean their data and make it available for public use. And then once they've done that, then we would start the harmonization process. I do think a few of the studies do have it already currently available, but it's not put into kind of a harmonized COVID data site. I think those are, I want to say ELSA, SHARE, and HRS do have some data already available. Yes. Are there any other questions? All right. Well, yeah, thank you so much for joining us. Yeah, I hope this was interesting. You know, I certainly think one of the most interesting, you know, uses of looking at this HRS family of surveys and all the work and time and effort that's been put in by these country teams and the international network of HRS sister studies is really focusing on middle income countries and what's happening in these developing economies that are so rapidly changing and are really, you know, struggling and grappling with the same kind of population dynamics that we see across the world of older people are really becoming the largest proportion of the population that they've been in our history. So again, thank you for participating in this webinar today. The slides and recording and data code will be available later this week in the webinar on the website. And if you have any additional questions, if you think of something later, you can always email our team. We have a help desk called help@G2Aging, where we answer any questions about the gateway or about getting access to the studies or starting your own research. So we'd be happy to interact with you that way also. But thank you, and happy holidays to everyone.